Welcome to the July 16th Community-Based Organization Working Group meeting. My name is Vivian Moreno, and I'm honored to serve as the new chair of this working group. Although this is my first meeting as a new chair, I did have a chance to meet all of you in separate meet and greets over the last couple of weeks, and I very much appreciate that. For the public listening, I'd like to share a little bit about myself. I'm a council member from the city of San Diego, representing District 8. District 8 starts just south and east of downtown in Barrio Logan, Sherman Heights, and Logan Heights area. It skips over National City and Chula Vista, and it's taken all the way to the southern portion of the city of San Diego, such as San Isidro and Otay Mesa Nestor. I was elected in 2018, but I served for 8 years on the staff of my predecessor, Councilmember David Alvarez. I do serve on the SANDAG board as an alternate and also as a member of the Borders Committee as well as the Public Safety Committee. And I also serve on the board of MTS. Community representation and outreach are very important to me. That's why I was thrilled to become the chair of the CBO working group, and I look forward to working with all of you. Before we begin the meeting, I'd like to ask Jane Clow, who's serving as our clerk today, to confirm if we have a quorum.
Yes, Chair, we do have a quorum.
Wonderful, thank you. Now, this is our first virtual working group meeting using this platform. So I'd like to review the process for both the working group members as well as members of the public who wish to speak under public comment. For the working group members, when you would like to speak, please click on the raised hand icon in the GoToWebinar control panel. It's on the top right of your screen. I will call on you, and then you will be remotely unmuted by staff. So there's no need for you to mute or unmute your microphone. In addition, when you are unmuted and would like to speak, please turn on your camera. Do we have any questions before we continue?
Chair, this is production. Just want a small correction. Your members do not have the ability to raise their hand. It would just be the public. So your members could just turn on their camera. They could wave to you that they'd like to speak.
Thank you. Jane, can you provide a quick reminder on how the public comment will work?
Yes. So as noted on the cover page of today's meeting agenda, in addition to emailed comments, the public also may provide live comments during today's meeting. In order to provide live comments, you must register for the GoToMeeting webinar at the link provided on the cover page of the agenda and join the meeting by clicking on Join Webinar link provided in the confirmation email you'll receive upon registering. When public comments are called for on an item, click on the raise hand icon in the GoToWebinar control panel. That was on the top right of the screen. You'll be called on by the name you registered with, and may provide comments for the allotted time. There's no need to mute your microphone. The organizers will unmute you when you are called on. The instructions for providing live comments also are on the bottom of the cover page of today's meeting agenda, which can be accessed from the homepage of SANDAG's website, www.sandag.org. All comments, whether emailed or live, will be made a part of today's meeting record. Thank you, Chair.
Wonderful, thank you for that. Number one item is a welcome and introductions. I'd like to start by recognizing that our region has been experiencing extraordinary times. First, due to the global COVID-19 pandemic and health crisis, but also as part of our nation's economic inequity and racial disparities that have been laid bare by this. COVID-19 has affected all of our communities, but we know that your communities have been hit the hardest, which we're going to discuss today. I want to note that during the pandemic, our CBO partners have gone above and beyond to keep their operations going and serving their respective communities. They've shifted to virtual outreach and maintaining safe social distant practices when they are open. We're always grateful for this group and their contributions to fighting against inequity, especially during times like this. While we are engaged in addressing the pandemic, I want to encourage you to explore opportunities to overcome the current challenges so that together we're going to emerge stronger from this crisis. Now, do we have any comments from the public, Clerk?
No, Chair, we do not have any public comments at this time.
Okay, thank you. So we're going to move on to our next item, which is approval of meeting minutes. If CBO members would like to offer any comments or questions, please either turn on your camera or raise your hand. So if we can now proceed to approving the meeting minutes.
Hi, it's Carol Lewis. I make a motion to approve the minutes.
This is Craig Jones. I second.
Wonderful. And just before, just for clarification purposes, the community-based organization working group is asked to review and approve the minutes from its February 6th, 2020 minutes. We have a motion and a second. Now, Clerk, if you could call each CBO member name by name, unless there are any hands raised or anybody on video.
Yes, I'll call the names. Craig Jones, Alliance for Regional Solutions.
Yes.
Rose Ceballos, Bayside Community Center.
Yes.
Monica Hernandez, Casa Familiar.
Yes.
Brenda Lee Rodriguez, Chula Vista Community Collaborative.
Yes, this is Brenda Lee, and but I have not received. I'm new in the position since a week ago.
Okay, do you want to abstain?
Abstain.
Okay. Okay, Carol Lewis, El Cajon Collaborative.
Yes.
Okay. Lillian Serrano, National Latino Research Center.
Yes.
Elizabeth Liu, Nile Sisters Development Initiative.
Yes.
Claire Grosvenor, Olivewood Gardens.
Yes.
Lorna de los Santos, Samahan Health Centers.
This is Fess Seligman representing her. Yes.
Okay, great. Sorry, I didn't see you there. Barry Pollard, Urban Collaborative Project.
Yes.
And Erica Leary, Vista Community Clinic.
Yes, I approve. Is that okay, even though I wasn't there, or should I abstain? I think Carmela took my place for that meeting.
Yeah, your choice. If
I
you
wasn't
read-
at the meeting either, and that's,
Yeah.
I think it's okay if you would like to vote.
Okay, I will approve.
All right. All right. So the measure passes.
Okay.
And
And
1, 2, yeah, go ahead.
one of the things that I forgot to mention is that we do not have a comment from the public on this item. Is that correct? Can you verify that, Clerk?
Yes, we do not have comment on this item from the public.
Okay, wonderful. And you mentioned the motion passes?
Yes.
Okay, wonderful. So we'll move on to the next item, which is item number 3, public comments. This is where members of the public shall have the opportunity to address the working group on any issues within the jurisdiction of Sandag that is not on this agenda. Do we have any public comments?
I do not see any hands raised.
Okay. Now, if
Don't have-
CBO members would like to offer any comments or questions, please turn on your camera. I don't see anybody on there, so we're going to move on to the next item unless there's any objection from the clerk.
Yep, that's
Okay.
fine.
Okay, so we'll move on to item number 4, which is the chair's report. I'd like to mention two things of interest to this working group. Number one, hearing on coordinated plan. The Transportation Committee tomorrow will host a public hearing on the coordinated plan. The coordinated plan provides a 5-year implementation plan of public transit and specialized transportation concepts described in the San Diego Forward, the regional plan. It establishes a regional strategy to provide transportation to recognized transportation disadvantaged groups, including seniors, individuals with disabilities, and persons with limited means. The meeting is the same platform as today. It begins at 9 a.m. and you could register by going to the calendar on the SANDAG's website and clicking on the Transportation Committee meeting. Instructions for registering are on the agenda cover. And now going on to item number 2 that I'd like to address is Shared Streets Pilot Program. In May, SANDAG established the Shared Streets Pilot Program to support local jurisdictions with providing safe space for residents to obtain essential goods, services, and physical exercise. Each jurisdiction in the region was eligible to claim up to $5,000 to help implement temporary shared street projects. Additionally, they can propose other potential projects to be funded in the event that not all of the jurisdictions applied. And now, as a result, 8 jurisdictions are implementing these pilot projects that range from closing residential streets to through traffic to creating space for local businesses, patrons to walk and dine while maintaining physical distance. CBOs are strongly encouraged to help promote these pilot projects on behalf of the following jurisdiction: City of Chula Vista, County of San Diego, Community of Fallbrook, El Cajon, Encinitas, Imperial Beach, La Mesa, City of National City, and San Diego's Emerald Hills, North Park, Normal Heights, and Pacific Beach communities. Now, more pilot program information is available at sandag.org/shared streets. Now, if working group members would like to offer any comments or questions, please either turn on your camera. I don't see anybody. Now, do we have any comments from the public, clerk?
Madam Chair, this is Craig Jones with the Alliance for Regional Solutions. If I may just back up to a quick comment on the coordinated plan. We CBOs were very involved in outreach and input for the coordinated plan for this year cycle 2020. Just want to confirm with staff that this coordinated plan, because it's required every 2 years, it's basically based on a continuation of the 2015 regional transportation plan. So the next coordinated plan would be up in 2022. And if things go as we hope, would be based on the new regional transportation plan. Just want to get confirmation on that.
Do we have any staff available to answer that question?
Yes, sorry, I was muted. The coordinated plan is, yes, updated every 2 years. So depending on the cycle and when the regional plan is approved, then it rolls into the following plan.
Did that answer your question?
Yes, thank you very much.
Wonderful. Okay, so moving on to the next item. We are on item number 5. It is a Sustainable Transportation Equity Program. It is on consent for information only, but I'd like to have a quick report on this. Jane, can you give us a brief explanation of the program?
Yes, Madam Chair. So the Sustainable Transportation Equity Project is a multifaceted pilot project sponsored by the California Air Resources Board that supports community capacity building and project implementation to increase mobility and facilitate reductions in vehicle miles traveled and GHG emissions. The pilot takes a community-based approach to overcoming barriers to clean transportation and addressing the express needs in low-income and communities of color throughout the state. The program has $22 million for 2 grant types. The first type is a planning and capacity building grant, which will have $2 million available for various sizes of grants. And this is to identify community residents' transportation needs and prepare to implement and prepare clean transportation projects. The second program is implementation grants, and this is $20 million for up to approximately 2 to 3 grants statewide that would include could include infrastructure, capital, operations, planning, policymaking, or outreach projects. The eligible entities that can be lead applicants are local governments, including transit agencies, and nonprofit community-based organizations, and federally recognized tribal authorities. And then for co-applicants, there can be a multitude of co-applicants, including those that I've already mentioned, but in addition, could be philanthropic organizations or foundations, and private companies that provide mobility services. And the deadline is August 31st at 5 p.m. And attached to the agenda is a full description and several handouts, fact sheets, including one in Spanish. And there are a number of community-based organizations in the region, including some of our partners that are looking into applying for the funding, and several cities that are looking at applying for this funding. So we wanted to make sure that everyone has the information.
Thank you. Now, CBO members, if you'd like to offer any comments or questions, please turn your camera on. Okay, do we have any comments from the public, clerk?
Let me see.
I don't see any, but.
No, I don't see any.
Okay, well, thank you for that information, and we're gonna move on to the next item, which is Darlene Hector Malmout from Sandag will be presenting item number 6, which is the 2020 Census Complete Count. Take it away.
Thank you, Chair, and good morning, everyone. My name is Darlene, and I am the manager of the Regional Census Data Center here at Sandag. As you probably remember, we are conducting the outreach, or we're coordinating outreach for the 2020 census. And the goal is to achieve a complete count, that everyone is counted once, only once, and in the right place. I'm here today to provide you an update based on the work that's been completed through and it's been completed and reported through the end of June. It's overseen by the Sandag 2020 Census Complete Count Stakeholder Working Group and the 2020 Coalition, the Count Me 2020 Coalition, which is a group of over 100 community-based organizations. Sometimes I hear people say 150. It's a massive group, and I know many of you are part of it. So I will dig in and go to the next slide, please. Actually, before I dig in, I just want to show you this slide that provides an update on the timeline. Like everything else in the world today, the 2020 census has been impacted by the coronavirus pandemic. And data collection began as scheduled in mid-March. The Census Bureau mailed the invitations, but follow-up by census takers or enumerators with the people who don't self-respond was postponed from mid-May to August the 11th. As a result, the data collection period had to be extended. Originally, the cutoff was the end of this month, July. Now it's going to go through October the 31st, with the counts being delivered to the president at the end of April instead of December of this year. So the reason I'm highlighting these changes is because there's still time for people to self-respond to the census and avoid contact with the census taker. So we're encouraging people to complete the census online, by phone, or using the hard copy questionnaire they received in the mail. Next. So now turning to the outreach activities, the focus is on communities at risk of being undercounted, to really hone the resources where they're needed the most. A hard to count index was prepared by the state of California based on 14 different factors to identify who these communities are at risk of being undercounted. Some of the factors that are included in there are lack of broadband access, the census can be completed online, This is the first time that that's ever happened. If you don't have broadband access, that makes it more difficult for you to respond. And then limited English proficiency is another one I highlight, because the Census Bureau does all their initial communications through the mail in English and Spanish. If you can't read one of those two languages, you're not going to know what's being requested of you. So this map shows the alignment between where the activities are. All those little dots represent different activities, and then the shaded areas show where the hard to count communities are concentrated, and the darker kind of orangish colors are harder to count, and the lighter tan colors are areas with less communities at risk of being undercounted. There have been over 5,600 activities reported through the end of June. Now, of course, the pandemic has eliminated the possibility of large in-person events. So the jurisdictions and the community-based organizations doing the work have pivoted, obviously, to virtual operations. Just to highlight a few, digital outreach has been expanded to include like Facebook Live events, directed emails, social media posts. Flyers also have been incorporated into food distributions and diaper distributions and everything you can think of. They've done car parades through neighborhoods at risk of being undercounted and street cafes. So that's just to give you a highlight of some of the things that are being done to maintain social distance. So you can see the work has been extensive. Not only can you see all the locations, but that we also ask people to report when they can the number of impressions. There have been 3.5 million impressions. That is 3.5 million times someone has either seen or heard a message about the 2020 census. And you can see that the alignment here with where these activities have been happening is consistent with where communities are at risk of being undercounted. Next. So digging in a little deeper about those impressions that I mentioned, every time a message is seen or heard, this table shows the estimates of each type of hard to count community. So immigrants and refugees, you can see them all listed on this slide. Now, I want to give you some caveats about the data. This information is not mandated because sometimes you really don't know how many impressions you're having. It's very difficult to guess. And then the level of confidence, even when you do an estimate, can vary. So what's tabulated here are the times that somebody did estimate, and I haven't taken into account that level of confidence, but it gives you an idea of the communities that are being reached. Next. Looking at impressions another way, this table shows those estimates by language. So you can see the large proportion that are in Spanish and some of the other languages here. So you can see the reach. Next. So as a reminder, well, first let's ask the question, how is the data collection going? So as a reminder, the Census Bureau is responsible for actually conducting the census, administering the questionnaire. And as such, they report the response rates. Right now, they're reporting them on the weekdays. And this summary here is based on Monday. So pretty up-to-date information. You can see that countywide, we're at 67.8% responding of all the residents in San Diego County, and that's only 0.2% away from what the response rate was in 2010. So wow. we're really making some progress. Yeah, we're pretty proud of that. And you can see that we have 13 jurisdictions that have reached at least a 2/3 mark of the response rate, and all of the jurisdictions are over 50%. Next. So even with that good news, more details reveal that there are areas with low response rates and lower than other areas. This map is showing you, again, based on Monday, July 13th, what the response rates were. The purple areas are the high response rates, and those tan areas are lower. So darker tan are the lowest. The rural areas you can see have pretty low response rates. That's partially impacted by the pandemic. How the census is administered out there, because a lot of people are on rural routes and don't have a real street address like people in the city do. They receive all their communications by PO boxes. The census takers have to go out to their houses and leave the materials there. That was postponed until May 25th. And they've completed that process as of June 30th, but we may not be seeing the true impact of that quite yet, but we expect it to be rising in the coming days. The members of our 2020 Census Complete Count Stakeholder Working Group and the community-based organizations, the Count Me 2020 coalitions, all our partners are really focusing outreach on these areas with the low response rates, not just hard to count, but the hard to count and the low responding ones, so we can really get the message out where it's needed most. To share some examples of how that's being accomplished, we're using social media advertising with geofencing, so it can really hone in on those areas. And then I talked about census parades or car caravans to drive through these areas. Next. So to close, I want to thank you for the outreach that you all are doing. I know many of you have been very active. Involvement of everyone is key in achieving a complete and accurate count so that the region gets our fair share of federal dollars that we need for infrastructure and vital services to improve our community. I'm happy to support your work and have listed my email at the bottom of this slide, so please reach out. And then I just put the link and the phone numbers for completing the census for your easy reference. Let's continue encouraging everyone and communicating that the 9-question survey is easy, safe, and important. This concludes my presentation, and I'm happy to answer any questions.
Wonderful. Thank you very much for that update. CBO members, if you'd like to offer any comments or questions, please turn on your camera at this time.
Madam Chair and
Go ahead.
Darlene, it's Craig Jones again. Just a point of clarification, Darlene. At the beginning of the presentation, you provided the updated timeline. With that updated timeline, are individuals and households able to complete their census questionnaire up through the end of October? Or are they cut off as of, oh, good.
Yeah, people can respond online by phone or by mailing in their questionnaire all the way up to October 31st, yes.
Thank you.
Also a question too, is it possible for people to go onto that site to double check to see if they did it or not? I imagine in all this chaos, people may have forgotten if they turned something back in early March.
My understanding is that you can't go in there and like verify anything, but you could go in there and put it in again, and then the Census Bureau would, kick out the duplicates later. Maybe I would suggest if someone was really in doubt, rather than doing that, because you don't want to create extra work for the Census Bureau, now that I'm thinking about it, is to call the number and just ask. If they still have their little verification number, maybe the call center could verify it. I'm not sure.
Okay. And then is that response rate being used in outreach and publicity? I'm just curious if it would be, appropriate to try to make a contest out of it. I see that Vista's below Oceanside, and
yeah, why not? A little fun competition never hurts. Sure, if it's motivating.
And so the data that you just presented, is that available in other places as well?
Right, yeah, so Erica, if you go ahead and give me your email, I can send you the link, because the Census Bureau has the response rates online and anybody can access it. It's open to everybody.
Okay.
Yeah, you'll have to kind of, jump through some hoops, because you'll have to drill down to San Diego County, but it's pretty easy. They have pull down menus.
Okay, should I put my email in the chat, or should I just follow up with Jane later after the meeting?
I'll send it to you.
Okay,
thank you.
Wonderful. I see Mr. Pollard.
Diane, Howard, good information. Thank you. I've got a question. Are the response rates tracked by ethnicity as well as geographic?
No, they're only geographic. However, you can kind of look at because we do have the ethnic makeup, of those geographies. So like if you want to zoom in on a census tract, you can kind of layer those things. And the state has these online tools where you can look at that, but I don't know, like Darlene completed it and this is her, background. I can't, that's not tied to the response rates.
And where that, personally, that seems counterproductive, since we're trying to target the hardest hit folks in our county. And how do we know? I mean, that's the letter of the law, but is that following the spirit of the law, I guess, is my question. Is that something that can locally be addressed, or is that more of a state or federal issue?
Right, so the federal government reports the response rates,
I got it.
that's all they tell us. So that we kind of have to work with what we have, but at the state level, we have the underlying demographics, and so we can overlay the response rates, and so you can see areas that have maybe a preponderance of a certain race or whatever, and they're low responding, and you can target it that way. And I'm happy to share that link to that tool with you so you can see that. So I think you can kind of infer it, but you don't know for sure, right?
Yeah, we infer things for decades.
Yeah.
And this is how we get into that sleep mode, by not making the racial component more of a priority. And so if we're not tracking it by race, not mutually exclusive, in addition to what we track other things by with the census, we need hard data. We don't need inferences. And I wanted to throw that in because this whole period of time that our country's going through is because people do not think in those terms. We avoid those terms. We don't want to talk about race. Oh, what about this race? And what about this race? I'm speaking of Asians, Latinos, African Americans, and people that are historically underserved and underrepresented. And if that is what the major selling point is for the census, it seems a bit odd that we're not tracking it accordingly. So there's my 2 cents.
Thank you.
Thank you for listening.
Absolutely. Are there any other board members who'd like to offer any comments or questions? I don't see anybody's camera on, so I don't see anybody from the public. Don't see them. I don't see any raised hands. Clerk, do you see any raised hands? Oh,
No.
here we are. Elizabeth Liu, I see you.
Yes, Madam Chair. I want to thank Mr. Paula for bringing up a very important issue here. I think I raised that question a while ago in one of the meetings I had with United Way partners. It was through Union Tribune outreach. I mentioned that, we are serving refugees, immigrants, and the underserved. And among this population are the Africans, the Burmese, Middle East, and Haitians. So when you ask a question about whether you are Black or Asian and others, so there is no provision of tracking the Haitians, the Africans, and the Burmese. So a lot of times people feel like this is not inclusive. The questions about race and ethnicity is not inclusive because there is no line that asks whether you are from Africa. And there is no line that asks whether you are from Haiti, you are Asians. And so that needs to be spelled out, because we are serving diverse community. And if not mentioned, and then in our grant proposals, what are we going to say? Which population are we serving when census doesn't cover it? So thank you, Berry Pella, for bringing that up.
Thank you very much. Any other board members? Well, thank you so much for the presentation. We really appreciate your time and all your information that you've provided us. We're going to move on to the next item. Item number 7 will be on what we are learning from COVID-19 and how it could impact transportation planning in the San Diego region. We have Elisa Arias, Ray Major, and Antoinette Meyer from SANDAG who will be presenting today on this item. Now take it away.
Good morning, Chair Moreno and working group members. My name is Elisa Arias, and I'm going to kickstart this presentation. And the focus of today's presentation is on what we're learning from the pandemic and considerations for our planning work. We started developing the vision for the 2021 regional plan about a year and a half ago in February 2019. And now we find ourselves in the middle of an evolving health crisis that has had significant implications for transportation, the economy, and our communities. Next, please. We're still required to develop a long-range regional plan that is multimodal and can be implemented with anticipated funding. We also have to prepare an environmental impact report for the plan, and both for adoption in fall of 2021. This slide provides some background on key provisions from federal and state laws that govern the development of regional plans. A compliant regional plan is necessary for us to be able to advance transportation projects that we're planning through corridor plans and other studies. Regarding climate, SANDAG is subject to Senate Bill 375 and regional greenhouse gas emission reduction targets. For our region, there are 19% per capita reduction in emissions from passenger vehicles compared to 2005 levels. Regarding air quality, the regional plan has to demonstrate that the transportation system meets federal air quality requirements for ozone or smog through a process that is called air quality conformity. At the state level, AB 805 requires that the regional plan also include transportation strategies to reduce exposure to air pollution in disadvantaged communities. The regional plan has to comply with Title VI of the Civil Rights Act, which prohibits discrimination. And since 1994, the Executive Order on Environmental Justice expanded to include low-income populations. Social equity is a shorthand term that SANDAG uses for this overarching goal of achieving equity and environmental justice for several protected classes, including those with disabilities. And finally, implementation of Senate Bill 743 requires that the impacts of transportation projects now be evaluated using vehicle mass travel as a metric instead of level of service. Next slide, please. So COVID-19 has had a significant impact on the economy, society, and travel. And we need to consider these impacts, especially in the short term. But our economy and travel in the region will recover over time. We're planning 30 years into the future or further out for our children and grandchildren. During the early stay-home orders, we saw almost empty roads and freeways, but traffic is up now. Emissions from cars and trucks also went down, but air pollution is now within the levels of the past 5 years. We saw buses and trolleys with just a few riders, but ridership is beginning to increase. Many essential workers relied on transit to get to work. Some people are able to telework, but a large proportion of workers have jobs that cannot be done from home. And we're also seeing more people biking and walking to get around. COVID has really emphasized the need for an equitable and adaptable transportation system that can respond to changes in the future. The vision that will be shared in August seeks to create a more adaptive and responsive transportation system. And we feel that this is an opportunity to plan the recovery with a focus on a more inclusive, sustainable, and resilient economy and society. We need a compliant regional plan to continue to bring transportation funding to the region to help with the economic recovery. And I think this is also the time for deliberate conversations and actions to lift low-income, Black, and Hispanic communities that have been most affected by this crisis. Ray Major will share data on the economic and socioeconomic impacts of COVID-19 on our communities, and then Antoinette Meyer will present on how travel has changed during the stay-home orders and as the economy begins to reopen. She will also talk about the role that telework has played and what we can anticipate moving forward, discuss the challenges of access to the internet and broadband for rural and low-income communities and impacts to distance learning and telehealth. And finally, how walking and cycling have increased in our region in the past few months. I'll turn it over to Ray now for his presentation on both the economic and socioeconomic impacts of COVID-19.
Thank you very much, Elisa. Next slide. The first thing that I kind of wanted to cover is that, you know, the economy goes through crises all the time. We are in a real big one right now, and I absolutely do not want to minimize the impact of the economic crisis that came after the health crisis caused by the pandemic, by the COVID virus. But I just wanted to kind of show that we get through these things. This graph shows over the last 20 years some of the crises that the economy has been through. In the early 2000s, we had the dot-com bubble, and then we had the September 11th attacks, which really completely changed the way that we traveled on airplanes. And that impact on air travel lasted probably 3 years. And then we had the housing market bubble, and we had a financial crisis that was caused by a subprime mortgage crisis. And then the auto industry went into a crisis, and that led to the Great Recession, the deepest recession that we've had since the Great Depression. And it took us about 10 years to get out of that, and boom, here we are again. There are a lot of different things that happen when you go into an economic crisis, and I want to discuss the different things that we're feeling right now. Next slide, please. So, okay, so we let this just finish building here. So the COVID crisis was really a health crisis that impacted the economy, and it impacted the economy because we needed to shut down certain type of high contact businesses in order to be able to try to control the virus, as you all know. But there are a lot of interrelated things that happened. It's not just that unemployment rates went up, and I'll talk about that a little bit. It's the local economy was hit very hard. Small businesses were impacted. Our tourism industry was devastated. People who hold these jobs find themselves to be unemployed. Those people who worked in the restaurants or the hospitality industry were particularly hurt. That hurts their families. We took a look at this by race and ethnicity, and we found out that the impact is not even across the spectrum. The different ethnic groups were hit harder by both the COVID health crisis and the following economic crisis. There's implications on retail and mental health and schools, et cetera. So a lot of things that are happening that are all wrapped up in this. And what I'm going to try to present in the next few minutes is just some of the information that we have that's related to this. We collect this information at Sandag to give to elected officials like Councilmember Moreno to make better and informed decisions for their communities so they understand exactly what's going on in the ground. Next slide, please. Let's talk a little bit about what has happened in the San Diego economy. In 2018 and 2019, we had nice growth rate here in San Diego. The gross regional product increased by 4.1% and then 2.6% respectively. Our forecast showed that we were going to grow in 2020 and 2021 at a slowing rate. That was the 2.2 and 2.0 that you see there in gray. But COVID hit, and you see that our gross regional product will probably go down by about 7.1% this year. That's what the forecast is calling for. And then increasing back in 2021 because when we're hoping that there's a vaccine that allows us to open up the economy. But essentially, we've lost the gains that we made in 2018 and 2019, and even some of the gains in 2017. So who got hit the hardest? Restaurants, cafes, shopping centers, theme parks, museums, libraries, movie theaters. And the people who work at those in those businesses saw traffic to their sites fall by as much as 70% at the bottom of this pandemic, and then now it's down about 40%. So those are really the industries that are getting hit hard, and I'll talk a little bit about why that is later. But that has a significant impact on our sales tax revenue. Our sales tax revenue in March was down by probably 25%. It was down by 44% in April and about 35% in May. Compare that to the Great Recession, when we lost about 9.1% in sales tax revenue during the first year of the Great Recession. And this is really important because the sales tax that we collect goes to help fund a lot of the public infrastructure programs. And at Sandag, we use it, we have a half-cent sales tax that we use, called Transnet, that we use to really get projects ready to be built. And so this is having a significant impact. Can we survive 3 months of reduced revenue? Probably. If this goes on for a significant amount of time, there are decisions that the elected officials are going to have to make in terms of what projects will or will not be built. Next slide, please. So how does that impact employment and unemployment in the region? Next slide. This graph shows the civilian labor force in the San Diego region, and you can see that it increased from about 1.3 million in January of 2000 up to about almost 1.6 million by January of 2020. So over the 20-year period, you see there's nice growth there. It even kind of increased during the Great Recession. What you can see, though, is with employment, which is the orange line, what happened. We went into the Great Recession. We lost about 100,000 jobs in a 3-year period. And it took us some amount of time to recover, almost 76 months to go from peak to recovery. And then we entered the longest expansion in the history of the nation, 120-month expansion, until this COVID pandemic hit. And take a look at what happened to unemployment and the employment in the region. It just absolutely plummets to basically, we lost 15 years worth of gains in employment in just a matter of a couple of months. Next slide, please. This slide shows what unemployment looked like on March 7th, 2002. Our regional average was 3.3%. And as an economist, we look at about 3% as full employment. That means that just about everybody who wants a job has a job, and that there are more job postings than there are people applying for them. So 3% is a very good unemployment rate. And as you can see, some of the areas in the region were a little bit harder hit, especially the ones in Councilmember Moreno's district. As she explained it, you can see that they were probably in the 4 to 6% range. But look what happened by May 9th. The average regional unemployment was 25%. The darker colors represent the harder hit areas, and you can see that there were areas that were as high as 36% unemployment, for instance, in Logan Heights. By June of 27th of 2020, as we started to reopen the economy, unemployment rates started to fall. In most places, we still saw about 1 in 5 people unemployed in the Logan Heights area. But the important thing to remember here is that it was on July 1st when Governor Newsom started to announce that we were going to roll back the openings. So this number is likely to climb, and it's probably higher now than it was when we made this graph. Next slide, please. This graph just tries to show the number of people in San Diego who lost their jobs over the weeks of this COVID crisis. We went from a 3.3% unemployment rate on May 7th, as I talked about, where about 56,000 people were unemployed, to having over 425,000 people in the region not having a way to provide for their families. And you see that we've been, as we opened the economy, things started getting better. But what you also see is that we still have more than a 250,000 people who do not have jobs right now, and it's taking a lot longer for these jobs to come back than it did for us to lose them in the first place. Next slide. Next slide, please. I'll talk a little bit about the different economic sectors in San Diego. So when we take a look at the San Diego economy, we take a look at the driving sectors, which are tourism, innovation, and military. You hear about those all the time as being the ones that are the driving sectors in San Diego. Healthcare, education, and government are supporting sectors. Those are kind of proportional to how big your community is. And then you have what would be considered the traditional economic sectors, things like retail, construction, manufacturing. When you hear on the news leading indicators like manufacturing is up or down or retail is up or down, they're really related. They're talking about those businesses in the red. San Diego has historically had a very diverse economy. We only had 42% of our economy in the traditional sectors, and the sectors in the blue and the green were pretty much resistant to recessions. They weren't immune to it, but they were resistant to it. But this COVID crisis has hit businesses in a very different way. And if you take a look at who was impacted from a high perspective, it was tourism, it's retail, it's transportation. In terms of moderate impact, healthcare, education, government, and manufacturing, and the rest of them have a lower impact. But about 63% of our economy was hit pretty hard by this economic COVID crisis. Next slide, please. This shows an index of employment by sector for the driving, supporting, and traditional sectors, and our recovery since 2007 when we first started measuring this as an index of 100. And what you can see is the supporting sectors continue to increase nicely, as did the driving sectors. The traditional sectors were hit very hard during the Great Recession, and you can see that it took all the way till 2019 for us to recover in terms of the number of employees that we had to where we were in 2007. So very long recovery, but look what happened. Our forecast shows what happened just in this last round of layoffs that are related to the current crisis. All of the sectors have been hit. The supporting sectors are down. The driving sectors, which typically do pretty well, are hit hard because tourism is hit so hard, and the traditional sectors are hit hard also. Next slide. This gives you kind of an idea of where the traffic to the different type of businesses has really been impacted. So general retail is down by around 35%. It's come up from the middle of April, when we had hit a low of probably 60 to 80%, but down 35%. Transportation is down 35 to 40%. You have food and beverages still down 25 to 45%, and with the rollback, you might see some of these get even worse again. That little purple spike there that you see, that's people shopping at the grocery stores prior to the COVID lockdown, when everyone was stocking up on food and supplies. The one bright point in our economy right now is the construction materials. A lot of people are doing home improvement projects, and so places like Lowe's and Home Depot look a heck of a lot more like Disneyland and SeaWorld if you try to get into them than they do a retail store. So those things are doing relatively well. Next slide, please. So who was impacted in terms of the type of jobs? And like I kind of showed you on the first slide, the Great Recession happened because there was a financial crisis that led to a housing bubble crisis and subprime mortgage, et cetera. It's all tied together, but it was in certain sectors. This crisis has to do, or the jobs that were lost have to do with people who have high contact intensity jobs. Those are people who have to do their work at within arm's length of another human being to make it happen. So those are people in healthcare, because doctors and nurses, for instance, or dentists have to touch their patients. Education, transportation, food and beverages, personal care services. These are the people who were hit the hardest, and there's a tremendous amount of job loss that you see in these areas. We did this analysis to try to understand how susceptible we were to the potential lockdown and the length of the lockdown, and you can see that a lot of people are employed in these type of industries. Next, please. So we did some further analysis to really look at who the frontline workers are by race and ethnicity, and so we were taking a look at essential frontline workers and non-essential frontline workers. And so these are the people who are out there every day, and they're the most exposed to the COVID crisis, if you think about it, or to the COVID virus, because the people who are not represented here are the ones who can work from home, right? So who is out there? The people in personal care, food services, and retail, those are considered non-essential. And then we have grocery stores, childcare, and social services, healthcare, and other frontline workers, which are essential. But what we did is we took a look at this by ethnicity. And what you can see is that the Hispanic population and the Black population are really overrepresented as a percentage of the workers in these industries. And so that gives you an idea that they are more exposed on a daily basis to the COVID virus. And I think you'll see that play out in some of the slides I'll show in just a minute. Next slide, please. So what is the impact on small businesses? 95% of the businesses in San Diego are considered small. They have less than 500 employees, and they employ about 50% of all of the people here in the San Diego region. Next slide. And what we see from the survey that the US Census did is that there's a decrease in their revenue every week through this pandemic. So even though we started to open up, and some businesses started to increase their revenue, things like some of the retail stores may have increased and some of the restaurants. Overall, we still see slowing in terms of revenue, and that's not a good sign, especially for these small businesses, because they need that money in order to pay their employees and to put food on the table for their families. And when you take a look at the number of paid employees, what you also see is that there's more people being let go in the small businesses than are being rehired. So this is concerning to me also, because we need the small businesses to be successful in order to be able to bring back the jobs that many of the people in San Diego work at. Next slide. You look at, again, in terms of the impact on businesses. So 82% of the businesses had a large or moderate negative effect because of this COVID crisis. 15% had little or no effect. So there are some businesses that are doing well. The bicycle industry, for instance, is doing very well. DoorDash and delivery services are doing well. Amazon is doing well. Like home improvement is doing well. So there are some that are doing well, but in the vast majority of the cases, businesses are not doing well. 8 out of 10 of them are suffering from this. When you take a look at government assistance, you see that 73% of the small businesses have applied for PPP and received it. 25% have applied for some type of economic injury disaster loan and received it. Only 1 in 5 businesses did not apply for anything. This is, again, is an important statistic, because if you take this and you look at it compared to the last slide, the reason that the people are still employed is because in many cases, there's been help coming from the federal government. So if we're going to continue to be in a lockdown mode, we're going to continue to need to be able to help these businesses with some type of program like the PPP in order for them to keep their people employed. Next slide. And how does that impact taxable sales? Go ahead and one more time. So at Sandag, we're very interested in taxable sales, primarily because we have the half-cent sales tax, but it also is an indicator of how the region is doing. The city of San Diego, for instance, has part of their income coming from sales tax, but also from transient occupancy tax, which comes from hotels and motels. So many different tax sources, property taxes, et cetera, and they all pretty much follow the same curve. But what this shows is since 1991, what sales tax revenue has looked like. And you see we went through a moderate recession in the early 90s, and sales tax revenue was kind of flat. These are billions of dollars in year collection. Mild recession in 2001. The Great Recession hurt us as we actually lost sales tax in terms of number of dollars we collected. It took 6.5 years to recover from that. But take a look at what's happened in 2020. All of a sudden, we lost about 13% of our sales tax revenue is what we're estimating for 2020 in terms of a loss. And that's very important because that goes to fund a tremendous amount of programs. You see that the increase in 2021, and again, that forecast is based upon us having some type of a vaccine by the end of the year and being able to get people back to work next year. Next slide, please. So the sales tax revenue in San Diego comes from many different sources, primarily, or the biggest one is really B2B. So businesses buying things from each other. And you can see that the sales tax revenue in May for that particular category is down by 50%. Restaurant sales tax collection is down by 50%. And when you think about it, the reason it's down by 50% because they're doing half as many sales as they were before, right? So this gives you an indication of how well the businesses are doing. Other retail includes Amazon and online delivery services. That's why they're only down 8%. Nobody is driving their automobiles anymore, or fewer people are. So you see auto repairs down by 36% in sales. Construction is doing okay. Department stores are also down by nearly 30%. Service stations are down by nearly 50% as people don't purchase as much fuel. Apparel stores are down by 3/4, and food markets are only down by 18% because people still need to eat. Next slide, please. And then one more. I'll talk a little bit about the impact on our communities. So when you take a look, we took a look at the data on May 30th. The slide on the right shows you unemployment in the San Diego region by zip code. You can see the hardest hit areas are in yellow and orange. And so that's basically the South Bay area going up into National City, the Logan Heights area, et cetera, going up to about 8 into the La Mesa area, just about where La Mesa is. And the one on the right shows you the number of COVID cases. And what you can see on that map too are the Callan virus screen disadvantaged community boundaries. So we put those on there to show you that in fact, those areas are all areas that have high cases of COVID. It doesn't take an economist to figure out, if you overlay the map on the left and the right, that both of those areas are going to, where you have high unemployment, you also have high number of COVID cases, or vice versa. And so what we wanted to understand is who was really being impacted. Who are the people who live in those communities who are being impacted most by COVID and unemployment? Next slide, please. What we found in terms of the top 25%, or these are the zip codes that are impacted most by both COVID and unemployment. And I'll just leave those there for a second so that you can see the zip codes. I'm not going to read them all, but they are the zip codes that are essentially south of 8. So although the entire region is suffering in terms of unemployment and there's COVID throughout the entire county, these are the areas that are suffering the most. And I think that's important to note, because as money comes to the region, what we need to do is we need to figure out how we can help the communities that were impacted the most by both the economic crisis and the health crisis. And so this type of data starts to help our elected officials see where the impact was the worst in the region. Next slide. We took a look at this by race and ethnicity, and what this graph shows on the vertical axis is unemployment by zip code, and on the horizontal axis, the number of COVID cases by zip code. The size of the bubble represents the number of people who live in that particular zip code. So if you take a look at the one in the upper left-hand corner, what this shows is that 44.9% of the Black residents in San Diego live in a zip code that has higher than average unemployment and live in a zip code that is higher than average COVID cases. Okay, that's how you would read this. So 42% of the Hispanic population lives in a zip code that has higher than average unemployment and higher than average COVID. When you take a look at the graph with the orange, the white population, 51% or 51.9% of the white population live in zip codes that have low unemployment and low COVID cases. So you can see that there's an ethnic disparity here in terms of where the highest unemployment and highest COVID cases are. And then the Asian graph shows something that's kind of relatively right, kind of in between the white and Hispanic populations. Next slide, please. So we take a look at the impact in terms of who's really getting hit. And what this is saying, that if you are a Black resident of San Diego, there's a 67% of the Black residents live in a zip code that is higher than average unemployment. 70% of the Hispanic population lives in a zip code that has higher than average unemployment, compared to 43 and 44% for the white and Asians. When you look at the COVID cases, more than half of the Black and Hispanic population have higher than average COVID cases. And when we look at the intersection of the two, what you see is that 45% of the Black population, 42% of the Hispanic population live in areas that have both high unemployment and high COVID, compared to 24 and 14 for the white population. So the one way that you can interpret this graph is that if you are a Black resident of San Diego, you're about 4 times as likely to live in an area that is suffering from both high unemployment and high COVID than if you are a white person in this region. Next slide, please. And so what does the potential recovery look like out of this this pandemic and the economic crisis? And as I kind of talked about at the beginning, eventually we will recover. That's the good news. There's a lot of work to do, and nobody really knows how long it's going to be. But we track a lot of things here at Sandag, and I just wanted to show you a couple of the things that we're tracking. Pre-COVID indexes were set to 100%, and you can see that everything except for basically home, garden, and equipment and building supplies, which are the two green lines, are still in the red. So unemployment is high, the VMT is coming back. If you look at airports, restaurants, and hotels, which are not only indicators of employment, but they're also indicators of the tourism industry and people coming to the region and staying here, you can see that they're all still down significantly. So we have a lot of things that we're monitoring at Sandag. Next slide, please. And I think this is my final slide. And what I really wanted to take a look at is, what does an economic recovery look like now in San Diego? So we take a look at all of the big economic forecasting houses, including the Goldman Sachs and the Federal Reserve and Oxford Economics, and you name it, everything that we can get our hands on. And we take a look at that to kind of understand where other people are forecasting, to see if our forecast makes sense. And you can see that our forecasts are right in the middle of what these big forecasting houses are thinking. But what this graph shows over here is that if we have a moderate recession from this, and we have about a 4-month disruption, and we have something like a long V recovery, which is probably the best case scenario right now, we will probably get back to a normal pre-COVID economy sometime in 2023. If we end up with a U-shaped recovery, which is something that we would encounter if all businesses can't get back to normal more quickly, and it's starting to feel like that might be the case until there's a vaccine, because we keep going into this cycle of shutting down, it could take until 2026 for the economy to recover. There are a lot of long-term effects that could happen from this, including workers becoming discouraged and leaving the workforce. I think you saw some of that in one of the slides that I showed. Educational disruptions, because students are not learning as well in this online world, and hopefully we don't see students starting to drop out because of that. There's going to be less investment by businesses in capital stock, which is the things that they need to use for their businesses, because they're not doing as much business. And then you'll see a lot of impact in the real estate and the commercial leasing market as we figure out what the stay-at-home policies are, teleworking policies, et cetera, which is what Antoinette's going to cover next. So thank you very much for your attention. And I'm going to hand it over to Antoinette now to talk a little bit about the transportation impacts.
Next slide, please. Good afternoon. Thanks for the opportunity to be here today. I think it was about a year ago, it seems like decades at this point, that I was visiting the CBO working group and talking to you about the 5 big moves as we were kicking off the 2021 regional plan. So it's good to be back here today. I wish I was with you all in person, but I think it's fair to say that the pandemic has completely disrupted every aspect of our lives, and transportation is really no exception. The transportation landscape transformed almost overnight. In March and April, when stay-home orders were put into place, we saw transportation demand drop sharply. Many of our freeways were close to empty. Buses and trains were also empty. But we've been doing a lot of research and collecting data on what's happening here in our region and across the globe. And the data suggests that this is not a long-term change. As our communities start to open back up, transportation demand has started to rise and will continue to rise. And we're seeing this in places like China and Europe, who are a bit ahead of us in terms of their recovery. You saw from Ray's presentation that the pandemic revealed that there's immense disparities in the region in terms of economic and health impacts associated with the pandemic. Similarly, the pandemic shed light on some inequities in transportation access and the ability for everyone in our region to participate in remote work and distance learning. And these are definitely important considerations for us as we move forward with the 2021 regional plan. Next slide. So I'm going to start with transit, and the chart on this slide shows the reduction in transit ridership across all of the services in our region for each month starting back in March. So ridership dropped pretty sharply, and you'll see that it reached its lowest level in April, with about a 70% reduction compared to the same period in 2019. Ridership has started to recover, and we're seeing increases each month as restrictions start to ease. Coaster is not doing quite as well as our buses and light rail, but overall transportation ridership is on the rise. Next slide. Ray shared that minorities are overrepresented in essential industries that require a high level of contact. And many of these essential workers who we're all relying on to get us through this pandemic are also much more likely to depend on public transit as their primary mode of transportation. 20% of those who take public transit to work do not have access to a personal vehicle. Transit riders also experience commutes that are much longer than those who drive to work. So the average median transit travel time is about 51 minutes, which is double the travel time to work for people who drive. So essential workers who depend on transit already spend a lot of time commuting, and they are at a far greater risk of having their livelihood impacted by any transit service level reductions that could be needed as a result of COVID. So this is, again, another important consideration as we plan for a future transportation system that creates more equal access to jobs and to healthcare and to community resources. Reliable, quality public transit that is fast, that's frequent, is going to be vital to making our critical connections more equitable. Next slide. In June, we conducted a regional travel survey to understand how people were traveling during the health crisis and their expectations for the future. The survey was distributed to 17,000 households that participated in our 2016 regional transportation study and agreed that they could be contacted for future research and surveys. The regional transportation study, just as a quick reminder, is something that we typically conduct about every 10 years. And we use the data that we collect. It's a major survey, and we use the data that we collect to update our travel demand models to support, planning and policy development. So between June 24th and July 1st, we had a 23% response rate with almost 3,800 surveys completed. That's pretty incredible in just 1 week. We were really impressed with the response rate. The survey results, I think, are positive for transit. They show that ridership will recover. We had 42% of survey respondents report that they used transit prior to COVID, and they're continuing to use transit into the future. A significant predictor of pre-COVID public transit ridership was ethnicity. So African Americans are much more likely than other races to use transit. 36% said they didn't use transit before and they don't have any plans to in the future. But a really surprising result is 18% of respondents said they did not use transit before, but they would after a vaccine. So that's good news. And only 4% who used transit before said that they wouldn't after COVID-19. So I think this suggests that the fear of taking public transit might not be as profound as we were expecting. And MTS and NCTD have been putting a number of measures in place to ensure that their services are safe and clean, which I think goes a long way to build public confidence in public transit. Next slide. Freeway traffic levels fell sharply as a result of the stay-home order. And the data on this slide is collected from hotspots on the 8 major freeway corridors in the region. Traffic volumes were their lowest in April, with about 50% fewer vehicles on freeways than during the same period in 2019. As restrictions again started easing, traffic steadily rebounded, and by early July, traffic volumes were down by only 18% from the same period in 2019. Next. The reduction in driving led to a noticeable reduction in vehicle miles traveled, and the California Air Resources Board said that this translated into a major drop in emissions and improved air quality in both March and April. But as you can see on the slide, the VMT on our freeways is steadily on the rise, and CARB has reported that air pollution has already returned to levels observed over the last several years. So as Elisa reminded us when she kicked off the presentation, that we have requirements to reduce VMT and GHG, so we need to continue to plan for a multimodal transportation system that not only meets these requirements, but has us trending in the right direction. Next. We are a binational region, and our economic vitality relies on the efficient movement of people and goods across the borders on a daily basis. Border crossings for both pedestrians and privately owned vehicles were down substantially. The data in the slide is for the 3 border crossings in San Isidro, Otay, and Tecate. It does not include CBX. Restrictions for non-essential cross-border trips went into effect in late March, and they've been extended into late July, and we've heard that they're probably going to be extended into August as well. So essential travelers are those people who have visas or work permits or citizens and that need to return for medical purposes or school or work or official government business. So since schools have been closed, cross-border travelers are likely those essential workers or people crossing for healthcare reasons. So again, April was the lowest number of crossings, but May data shows that crossings are beginning to increase again. Next. So our regional travel survey also asked people who owned a car if the amount they were driving had changed during the health crisis, and 89% reported driving less, but most do not expect that this is going to continue and reported that they will be expect to be driving more over the next 6 months. Although many residents were driving their own car less, they reported using online shopping and delivering more, and they expect to continue with this into the future. So while they're not driving their own cars to the store, they are still generating trips and VMT associated with the delivery of goods and food to their home. The most common reason people cited for driving less was not visiting family and friends or going to recreational activities. Less than half reported that they were driving less because they were teleworking. And about half of those who were teleworking said they expect to continue teleworking at some level in the future. Next. We also conducted interviews with 137 employers that represent some of the largest companies in the region across a range of industries, from retail to hospitality to healthcare, government, and tech. The intent of this survey was to help us understand the level of telework that's occurring in the region during the health crisis and then employers' plans for telework in the future. More than half of the employers that we spoke with had employees teleworking. Only a quarter of those employers actually had offered telework prior to COVID-19. So this was definitely a crash course in telework for many organizations. When we asked companies if they would continue to offer telework in the future, it was mixed. We have a quarter that said yes, they would. About half said no, and 28% are still on the fence, saying maybe. So we're hoping through our iCommute employer outreach program, we can help move some of those maybes over into the yes. Next. For the companies that will continue offering telework, most expect about 25% of their workforce to continue. Very few, only 7% said their entire workforce. And in terms of frequency, 9% will offer it on a full-time basis. The most common response, though, was 2 to 3 days a week. So 71% of the employers we spoke with said part-time. Go ahead, next. We asked employers about the perceived benefits of telework, and interestingly, employee satisfaction, productivity, things like helping the environment ranked higher than cost savings in commercial space. So that was a surprise as well. Next. Setting telework targets is something that we do for the regional plan. I'll talk a little bit more about this target setting process in a couple of slides, but telework is one of the strategies that helps us to reach our VMT and GHG reduction targets. However, the telework targets that we set have to be backed by data to be accepted as reasonable by the regulatory agencies. So our assumption for the 2021 regional plan is that telework will grow more than we've anticipated in the past. But we know that many occupations cannot be done from home. So to understand the potential for telework in the region and to help us with setting these targets, our senior economist did an analysis of jobs that are conducive to telework and found that 39% of occupations in the region are considered home workable. This is a little bit higher than the national average, which is 34%. But it's important to keep in mind that just because a job is considered home workable does not mean that it will be worked from home. It's really at the employer's discretion to determine who gets to telework and why. We also looked at the percent of jobs that are considered essential as defined by the federal government, and about 64% of occupations are essential. A far fewer percentage of essential jobs are conducive to telework. Next. One of the data sources that informed this analysis is a national study that came out in June from the University of Chicago Booth School of Business. It's a study that's getting a lot of attention. And one of its key findings is that jobs that can be done at home are typically higher wage jobs in professional services. So jobs in finance or information-based jobs have a chance to continue with some degree of normalcy as they can be performed away from home and from other people. But for just about everyone that works in hospitality and tourism, which Ray shared with you is a sector that employs quite a few people in our region, or other essential industries like agriculture and healthcare support and transportation. These are jobs that generally cannot be done at home, and they tend to be lower wage jobs. So the workers in these sectors are disproportionately hurt by the shutdown and by the inability to do their jobs from home. And as I pointed out earlier, many of these workers rely on and need quality public transportation to get to their jobs. Next. Next slide, please. The national data is consistent with what we know about the typical teleworker in our region. According to census data, in normal times, about 80% of teleworkers in our region are white, and over 30% earn more than $75,000 per year. So it's upper income and fewer minorities that are teleworking. A common misperception is that teleworkers don't drive and don't generate VMT. Our data from our regional transportation study, as well as national data, demonstrates that while teleworkers may not contribute to peak period congestion, they tend to take many more discretionary trips for things like shopping and recreation. Data from the US National Household Travel Survey actually found that teleworkers take about 11% more discretionary trips than non-teleworkers, and those discretionary trips are about 16% longer. And there's a number of possible reasons for this. One is the teleworkers aren't trip chaining, so running errands on their way to or from work like typical commuters generally do. But I think the other is probably that teleworkers want to get out of the house. They want to socialize more. They want to use their free time to do activities away from home. And I think many of us who have been teleworking can probably relate to that desire. Next slide. So in terms of how we handle telework in regional plans, we've been setting some pretty ambitious targets for telework since our very first regional transportation plan with the Sustainable Communities Strategy back in 2011. And you'll see that the targets have changed over time, and this is really based on data availability and recommendations that we've sought from third-party advisors and consultants that help provide validation to CARB. So the targets represent the percentage of the employed population in the region that could be found teleworking at least 1 day per week. And when we started back in 2011, we had very little data on true telework in the region. We relied on census data, which reported about 6% of the population working from home, but this includes, like home-based businesses as well. So we didn't know who was actually teleworking, what was a home-based business. So since that time, we have been conducting our own research on telework. We survey employers, we survey commuters on a much more regular basis, and we seek recommendations from consultants and academia, and we've adjusted our telework rates accordingly. Now that we are planning for the 2021 regional plan, we're proposing rates that are much higher. We think it's achievable because more companies now have experience with telework due to COVID, and many are expecting to continue with telework at some level in the future. We had the proposed targets validated by our independent third party. It's the University of California Institute of Transportation Studies. And to help us reach these numbers, our iCommute program is in the process of developing a telework pilot program that will provide employers with both technical support and some incentives for expanding telework into the future. Next. It's important to note that achieving these targets, though, will require broadband connectivity and home internet access. And COVID also shed light on the digital divide that exists in our region. 23% of low-income households lack a broadband subscription, and 20 to 40% of students in many of our local districts lack home internet access or lack a device to be able to participate in distance learning. The digital divide between urban and rural communities is also pretty distinct. So less than half of the rural population has quality fixed internet service versus 97% in the urbanized areas. So closing this digital divide is going to be an important aspect of transportation planning moving forward so that everyone is able to benefit from transportation technology improvements and app-enabled transportation services, as well as remote work and education and healthcare. Next. Like telework, an area of transportation that saw a significant increase, though, was biking and walking, and this is good news. 14% of respondents to our regional travel survey reported biking more, and 50% are walking more, and almost all of them expect to continue this in the future. And this is for recreation, it's for shopping, it's for errands, it's active transportation across the board. This trend is receiving a lot of national attention, actually. Bikes have been running out of inventory. Personal bike sales doubled in the US in March compared to the previous year. Next, please. And this increase in biking was validated by data that we collect on the 8 corridors where we have eco counters. So each dot on the slide represents the total number of bike trips in that corridor during May 2020. And overall, we saw a 91% increase in bicycle volumes compared to May 2019. Next. The percentages along the left show each count site's percent increase. So you'll see that we saw a major increase in North County, San Marcos, Pacific Coast Highway, but also in Chula, Vista, the Bayshore Bikeway, and then the little inset there is the urban areas, the bikeways in the urban areas. Next. In May, we responded to local jurisdictions' need to create safe spaces for people to walk and bike and recreate during the pandemic by creating what we call the Shared Streets Pilot Funding Program. 11 jurisdictions requested funding, and we awarded $95,000 to those jurisdictions to implement a variety of projects. Some of them are featured here on the slide. You have El Cajon up in the top corner, creating a wider sidewalk for people to be able to walk in your parks. National City implemented their Shared Streets program, partially closing down roadways for people to bike and recreate. And Encinitas took over some of the curb space to have outdoor dining where people could eat at restaurants safely outside. So a lot of really great projects. Excellent feedback that we're getting. It's been overwhelmingly positive. And I think there's a strong desire to continue with these efforts into the future post-COVID and perhaps transition from some temporary measures into more permanent solutions. Next slide. So before I touch on next steps, I just want to summarize how these findings are informing the regional plan development process. So COVID certainly
Fire. I apologize for interrupting, but we want to be able to have a conversation or allow the CBO members to have comments or questions. And we're running out of time. We only have 10 more minutes. So if you could wrap it up.
Yep. So in terms of next steps, we're giving this presentation to the Joint Policy Advisory Committees tomorrow, Friday. The same presentation goes to the board then the following Friday on July 24th. And then the presentation of the vision for the 2021 regional plan will follow 2 weeks later. So the same order of operations with the joint PAC and the board of directors. So we're hoping that the information that we're providing through this presentation will help inform some of the policy conversations we're going to be having around the vision and the 2021 regional plan. So that's the end of the presentation, and Ray, Elisa, and I are here to help answer any questions that you might have.
Wonderful. And once again, I apologize for interrupting you. I think anytime you see Miss Arias or Mr. Mayor, I'm sorry, Ms. Mayor or Mr. Major in any SANDAG meeting, you are about to get really good information that just makes you really think about how we move forward, not only as legislators, but also as nonprofits. So if CBO members would like to offer any comments or questions, please turn on your camera. I do want to let you know that we have about 10 minutes for questions and comments. So let me see, I don't see anybody on. Jane, do you see anybody?
No, I don't see anybody with raised hands.
Yeah, and before, if there is a lot of robust conversation, I'm happy to continue this discussion, but I see Miss Elizabeth Liu, so go right ahead.
Thank you, Madam Chair. I would like to ask Mr. Ray if the presentation, the PowerPoint is available for community, for us. I'm interested in the number of unemployment rate. So if that resource is available, thank you.
Thank
yes,
you.
It is available.
Ms. Leary? Oh, go ahead. You'll follow up, Mr. Major?
Yes, can you hear me?
Yeah.
Oh yeah, so we have that information on our website, and we can make this PowerPoint available to anybody who's on this call. Just contact Jane, and she can send you a copy of it. So it's all public.
And it's on the working group website on under this date. It's there as supporting. It's called supporting materials.
Wonderful, thank you, Miss Erica Leary.
Thanks. Yes, also just a question for Mr. Major. The the graphs that showed the quadrants of highly impacted by unemployment, COVID, and race. Am I correct that that would not necessarily include North County areas because all of the highly impacted census tracts were in the southern part of the county?
No, it includes all of the census. It includes all the zip codes in the county that were on the maps that I was showing. So it includes North County, but the North County typically fall in the lower left-hand quadrant, which would be low unemployment and low COVID cases. Along the 78 corridor, we do see a higher rate of unemployment. So you may see them falling into high unemployment, low COVID quadrant. So the impacted communities were the ones that fell into the upper right-hand quadrant that were both high COVID and high unemployment. That was what that's what that purple map showed when we distilled the data.
Okay, and that was for San Diego as a region. Hypothetically, if we looked specifically at North County, we may see same kinds of trends, but on a different scale.
Well, you wouldn't see. Well, it depends what your base is. If you only looked at North County, you would see something completely different. But when you look at it regionally, there's not as much COVID and there's in North County as there is in. Thank you for bringing that up. So there's fewer cases of COVID up in the North County, and so high unemployment and high COVID. And if you go, can you go back to the map that has the two colors on it? The two maps that are side by side, the one before this one. This map shows where the high unemployment rate is, which is the yellow areas. You see there is some along the 78 corridor, but you see that the COVID cases are lower. The COVID cases are much higher in the southern part of the county, and the unemployment is also higher in the southern part of the county. So that's the part of our county that's impacted the most.
Got it. Okay.
Okay.
Thanks very much.
Sure.
Thank you, Mr. Pollard.
I had a couple questions. One is, and Ray, the information as usual is very, very good, thorough, and interesting. This may sound weird, but I look forward to your presentations when you're when you join us. I was interesting, the same graphs that Erica mentioned, are those going to continue to be tracked so we can look at the pace of recovery as we move through this?
So what we're doing is updating, we're doing a small business report that comes out next week. And then the following week, we're going to update based upon the new COVID and new unemployment numbers. We'll take a look at which areas continue to be most impacted. So yes, we will be tracking this as long as we are in a crisis.
Okay, the other question I had, and this is sort of for everybody, so bear with me. I'm gonna start sounding like a broken record. I was working on a grant and happened to stumble across an early 1900 map of San Diego's redlining practices. And oh my God, they are exactly the same today than they were over 80 years ago. So,
can you share that map with us?
I'm sorry?
Can you share that map with us?
I absolutely will. It's come from the Greenlining Institute in Oakland, California. And I will share that. And I have been using that as a little overlay in all of these disparities. And so this is a question, maybe Councilmember Moreno, this is for everyone. Because in my humble opinion, focusing on those redlining issues consciously is a very good place to start. I'm very disappointed that the census is not tracking this information by race, at least on a local basis, because the data is there. Rather than having to have someone tell people to do it, it is the right thing to do to track it, in my opinion. So addressing the redlining issue is going to cut all across city and county departments, because it gets into a matter of priorities as we move forward. Having it on the back burner, it being the disparities in these communities, has not worked. And so I would be interested, maybe not in this session, but in sessions in the future, to talk about if that is doable, and if so, how does this get done? Because it goes across education, City of San Diego, County of San Diego, health. All of these disparities have literally not turned up the heat on getting the redlining / underserved communities just back up to par. So that's going to be a very long-term conversation and a very rough, messy, and ugly one. Because what that means is that some communities that have been given higher priorities in the past may have to acquiesce, because for the past 40, 50, 60, 70 years, we haven't enjoyed that. And so I'm really excited to hear about conversations all across the city, county, and education on how this is going to be remedied. So I applaud your data, all of you guys, Antoinette, you as well, is including race as a factor. Let's bring that up and quit hiding behind it. I mean, thank you guys for bringing that up. It's ugly, it's embarrassing, and it's threatening. It's scary to a lot of people. So the more we talk about this, I think the less of that fear is going to be recognized, and people are going to be able to merge that philosophy into the past systematic racism that we have lived with for decades.
Okay. Now, Mr. Pollard, I do not want to limit the discussion. And I see that Monica has joined in, Miss Monica Hernandez. I'm going to take the chair's discretion here to table this item so we can continue to have a robust conversation at the next meeting. I also think you and I need to have more of a discussion offline on this topic. So I'm going to be tabling this item for our next meeting. And so we're going to end the discussion today, but we'll continue it. Once again, thank you to Ms. Arias, Mr. Major, and Ms. Meyer. Always a pleasure to see you guys. I get very excited every time I see you guys are presenting, because I know you have a lot of very valuable topics, a lot of very valuable information for us. So thank you for your time, and we're going to see you guys next meeting. And so we're moving on to the next item, which is item number 8. Staff is organizing a set of public workshops to share the vision in the 5 big moves. We're going to have more information soon, and that's on the possible topics for the next meeting, including this conversation that we're going to continue. Do we have any comments or questions from the board members? And this is on the possible topics for next meeting.
Madam Chair, could we just have an update, a quick update on the next meeting about the STEP grant applications from our region?
Absolutely. We'll definitely add that. Anybody else? This is on next topics, and always feel free to reach out to me if you want to add any topics. I'm more than happy to bring up any topics you think that are pertinent. So our next July meeting was moved, our July meeting was moved to today, but normally the working group meeting will be the first Thursday of the month. Our next CBO working group regular meeting is currently scheduled for Thursday, August 6th at 11 a.m. However, SANDAG staff is working on setting up workshops to explore the vision of the 5 big moves, and we may be getting meetings later in August. Now, we're getting close to the end of our meeting, and I would like to ask the board, the CBO board members to turn on your camera so that we can memorialize this meeting on our social media. So if you guys don't mind turning on your cameras, yes, go ahead. Everybody turn on your camera.
It'll only allow 6. Apparently. Oh, I can see more than that.
Yep, we're gonna try to get as many as, so everybody get ready. My staff is ready. And We'll be
Maybe we
sending
take
you
off
these
the,
images.
go ahead.
I'm sorry?
Yeah, go ahead.
Okay, are you guys ready? Let's go. Everybody say cheese. All right, so we got it. And so, I'm sorry, go ahead, Jane.
Yeah, hang on one more time.
Okay.
Okay.
Wonderful. Well, thank you, everybody. This has been a wonderful meeting. I very much look forward to the next meeting. All the presentation is online. If you guys need anything, please do not hesitate to contact me or Jane. And with that, concludes our meeting today, and we are adjourned. Thank you.
Thank you.
Thank you, everybody.
Oh.
Good job.